Thank you so much for clicking on this video. Welcome back to my channel, and if you are new, thank you so much for stopping by. Consider subscribing. So in today's video, I'll be talking on diabetes. Diabetes is one of the most common diseases in our society today. So what is this diabetes? Diabetes is a metabolic disorder caused either by a deficiency of the digestive hormone called insulin or the inability of the body cells to use the available insulin. So when we talk of diabetes, there is one organ in the body that requires attention. The organ is the pancreas. So what is the pancreas? The pancreas is an organ that excretes the hormone insulin and pancreatic juice, which contains enzymes involved in the digestion of fat and proteins in the small intestine. So this pancreas produces two hormones, insulin and glucagon. So this glucagon raises the concentration of glucose by breaking down glycogen, that is stored glucose, into glucose and then raising up the blood sugar level and preventing it from falling too low. So the work of this insulin is to regulate the blood glucose level. So what are the types of diabetes? There are two types of diabetes. We have the diabetes mellitus and diabetes insipidus. These are the two types of diabetes. So diabetes insipidus is a condition of polyuria, that is excessive or frequent urination, and polydipsia. Polydipsia is just excessive thirst, that is when you feel like to drink water all the time due to the deficiency of the hormone called diuretic hormone. So this is for diabetes insipidus. Then diabetes mellitus has two subunits. Okay, we have the first one, the juvenile diabetes, also called insulin dependent diabetes mellitus, and secondly we have the maturity onset diabetes, also known as non-insulin dependent diabetes mellitus. So this juvenile diabetes is common in children and young adults due to lack of insulin, but thank God that this insulin can be injected into the body. So for the maturity onset diabetes, which is also known as the non-insulin dependent diabetes mellitus, this one is common in middle-aged people. In this case, there is insulin in the body, okay, but the body cannot make use of the available insulin. So that is the types of diabetes. Then what are the causes of this diabetes? One is heredity. When it comes to diabetes, is genetic, okay. So this does not mean that everyone must have this diabetes. While it is true that diabetes tends to run in families, it does not necessarily mean that everyone born into such families will develop diabetes, okay. Nor does it imply that those who do not belong to such families will never have diabetes. So in families where diabetes tends to run with in their gene, proper medication is what needed, and proper precautions are really needed, okay, so that they will not develop diabetes. That is for the heredity. Then another cause of diabetes is overweight, okay. Diabetes tends to easily occur to people that are overweight. So there is nothing like healthy weight. Another thing is lifestyle. Lifestyle is very important, okay. Know what to eat. When you reach some certain age, there are some things you need to minimize, okay? I would advise you to always consult a dietitian to always plan your meal for you. Then another thing that can cause this diabetes is wrong medication. Self medication can damage the pancreas, and when the pancreas is being damaged, insulin cannot be produced. So say no to self medication. It is true that in some countries, going to the hospital, running tests before getting your medication is a bit expensive, but it is better than just going to a pharmacy or a chemist to just get a drug. You don't know the side effect of the drug that you are taking, so avoid wrong medication. So the next thing is now the symptoms of diabetes. At early stages, okay, diabetes does not really show any symptom, but there are some symptoms that you see, know that yes, there is tendency that this person is diabetic. So the first point is polyuria, okay? So this polyuria is simply excessive urination. Someone with diabetes will always experience frequent urination. Then another symptom is polyphagia. This is excessive hunger, and this is abnormal hunger. It's also a reaction of the body to a lack of glucose, because when you lack glucose, you feel like to eat, okay? So the person is being tempted to eat more and more. Yes, the more food you eat, the more the glucose in your blood level, and the body weight also increases. So that is for the dyspepsia. Then another reason for another symptoms that one is really diabetic is polydipsia. This polydipsia is excessive thirst due to large amounts of fluid lost through urine. So due to that frequent urination, which I have mentioned before, they will always experience excessive thirst, okay? Then there is also loss of weight. So because the cells are being starved of glucose, the body will begin to make use of the stored fat to nourish the cells. So when this continue for a very long time, the person begins to lose weight. Then another symptom is weakness and tiredness. So in addition to using body fat, okay, because when you are hungry, the body will start breaking down the fat and proteins in your body. So the body will also feed on protein and causing muscle wasting, okay? So this will now lead to general body weakness and tiredness. So weakness and tiredness is also one of the symptoms of diabetes. Some might have itching, okay, like constant itching all over the body, especially in the genital areas, okay, is also a sign of diabetes. So another thing I would like to touch is diet for diabetic patients, okay? So as a diabetic patient, it's good to avoid eating twice or 3 times daily. For such meals are what? They are heavy and they will elevate your blood sugar level, because there is no sufficient insulin in the body to break down the large quantity of food. Instead, eat like 5 to 6 times, but just a little at a time, okay? So it is healthy to take fruits as a diabetic patient, okay? So do not combine your fruits with any food, okay? This is always a mistake that diabetic patients make. Some of them, they even avoid fruits because they've been advised that fruit contains sugar. No, you really need fruits, okay? So if you want to eat something like papaya or pawpaw, as some do call it, eat only papaya at a time, not in combination with rice or beans. Same with other fruits and vegetables. Eat plenty of onions, garlic, carrots, ginger, okay? So green vegetables such as bitter leaf is also very good for the body. So People that are diabetic should always squeeze bitter leaf juice, and take the extract. It will really help them. So I believe that after watching this video that you will save a soul by sharing this video. Thank you, and see you